Well, good day again, everybody, and thanks for joining us here today for our next in the series of our data-driven agriculture webinars, where we talk about using digital agriculture to enhance our crop production, our livestock management, forest management, making sure that our food is safe, and all the things that go along with that. I'll introduce our speakers here in just a moment, but first I want to make sure that we recognize some of the resources that are available to you. And if you're not aware, we talk about this every week, and filling in here for Dennis Buckmaster, and so hopefully I can do as well as Dennis does. We have our Digital Ag Resources website. Make sure that you check that. We have resources in terms of education. We have it broken down in terms to various domains that you can visit. There's stuff on it, education, extension, research. We have a glossary, events coming up, and all that type of stuff. And then we also have a link to the recordings of these. Eventually, each of these presentations is recorded. Another great site to go to is the extension UAV site, the drone site. Very attractive looking and lots of great information on there. And so on the middle bullet there. And then we need to recognize, of course, that this is sponsored by the WIN organization, the Wabash Heartland Innovation Network, that provides a substantial amount of our funding as part of the Lilly Endowment. And so coming up, just so you know what's in the pipeline here, today we're going to talk about produce safety. Boy, there's a lot to talk about there in terms of food safety. Then in another week, we'll talk about, Nate DeLay will be with us, and there'll be discussions about data and how we value that, which is what is it, the thing you hear on the news, a non-fungible type of thing. You can't touch it or smell it or see it or whatever, but it really has value. Deep learning stuff on the next week from Dorinda Saraswat, and on down the line. We've got on May 6th, Nicole Widmer is going to be talking about some of the way that data is used for the public good. So a couple of housekeeping things before I introduce our two speakers for today. If you have questions, we certainly welcome them. If you don't have a question, I'm sure going to have a question or two, but use the chat room to ask your questions. I'll be monitoring that. Leave your cameras off, if you will, and your microphone muted during the presentation. But at the end, if you want, we can open you up and you can verbally ask your question. And like I say, we're recording this for later consumption. So we have two presenters today, both in food science, and they're going to go in this order. First of all, Amanda Deering. Amanda is an associate professor in our Department of Food Sciences here at Purdue, a quite noted department. We've had a person win the World Food Prize from that department. Amanda does a lot of work out in the industry, according to her bio that I'm looking at right now. And she has a degree, a PhD from Purdue University. And it looks like she works quite a bit with melons in the state, and I'm sure a lot more than that, Amanda. And Dr. Deering has won a number of awards, the Millionaires Club and the Outstanding Extension Faculty Award, amongst a couple of them. Okay, and then I'll just do a quick introduction to Dr. Crandall then also. And she'll be our second speaker. She owns her own company, which I always have a lot of respect for people that are able to do that. It's called Safe Food and Root, LLC. And she's also some past experience. She has a Purdue degree also, and some past experience with working with Kroger and with Safeway. So at this point in time, let's turn it over. The first segment will be Dr. Deering to talk about some opportunities for big data to enhance the safety of our produce. And so, Amanda, I think you can share your screen now, and let you just take it away.
All right, thanks, Bruce, for the introduction. I think, can you stop sharing?
Yeah, there we go.
Yeah, perfect.
Yep.
So as I get this pulled up here, So as Bruce said, I'm in the Department of Food Science at Purdue and do a lot working with growers throughout the state. And so teaching good ag practices mostly, but really anything related to food safety we'll take a stab at. So I'm located on campus, but I also have colleagues, Scott Monroe, who's kind of my counterpart down in Southern Indiana. So between him and I, we work the entire state on anything related to produce safety. So today what I'm going to do is I'm going to talk about some of the issues related to produce safety, and then kind of be more, I guess, giving ideas of how the big data that we do actually have in the produce food safety world, and maybe some applications that we could use to actually utilize this data to our advantage. So I'm just going to start here. So why do we care about food safety? And I always typically start with this slide because sometimes, we are so fortunate that we live in the US and have one of the safest food supplies in the world. And so sometimes we forget about food safety because it's not necessarily something we experience on a regular basis, unlike other countries. So we do have typically, millions of people getting sick each year and many people dying from foodborne illness, which, some people will say, well, it's only 3,000 people, but most people don't think eating a cantaloupe is going to be your way out. So thinking about produce safety that way, we just is not on our radar for the most part, and bringing awareness to it, I think, is important. So which foods make us sick? So traditionally, the foods that made us sick were animal or animal-based products, because those products were where these bacteria are naturally found. So for example, excuse me, E. coli is typically found in cattle. And so any products related to that, which we figure that out, ground beef, we need to cook to make sure it's not contaminated. So those are the kind of products that we typically saw foodborne illnesses associated with. But then about 10, 15 years ago, we started making this switch to produce. And so now produce accounts, and this is out of date. I don't remember the exact date that's this graph is from. It says 2008. I would guess now it's over 50% of the foodborne illnesses associated with fresh produce. And there's a lot of things that can be attributed to that. We're just better at finding it too and reporting it. So bacteria are everywhere, and that's what I always teach growers. We never are going to eliminate all the bacteria from the farm, but we do need to know how to evaluate those risks and reduce the risk that contamination can happen. So we know they're associated with foods that aren't cooked, so like raw milk, raw ground beef, leafy greens, and they can be a farm to fork contamination event. So really anywhere in that distribution chain, you can have contamination. And when we look at the farm, right, there's a ton of sources of contamination. So really, I could just sum this up and not put all these pictures and just say everything, right? So we know that bacteria are there and we're not going to prevent it, but we have to reduce those risks of having contamination. So if we cook food, we know we can kill the bacteria. So we cook it to the proper temperature for the appropriate length of time. We know we can get rid of the bacteria, no problem. However, that's the issue for fruits and vegetables and leafy greens, that most of them we eat raw, right? So we don't cook them. So we don't have that benefit that we can be messy on the front end because the back end is going to clean it up because we're cooking it. We don't have that luxury. So that's why in the produce world, we have to really focus on right from the farming, in the planting to the harvesting to the packing to the transport, that we're careful in all those different areas. So when we think about food in general, right, where can contamination happen? And that's kind of what I said before. It's from farm to fork. So in any of these different, from the farm to the manufacturing, even when we get into retail. So I know a lot of farmers I work with, that's what they always say, we're so careful, we do this and that and the other thing. And then I I go into retail, I go into a grocery store, and I see my cantaloupe commingled with 4 other brands of cantaloupe in the same bin. And, if there was a recall, how would I know that it was my cantaloupe and not the other cantaloupes that were in that same bin? So that can happen, as well as at the consumer level. So we do have Betty Fang in food science is working more on the consumer side, and it is important that we do have that education on the consumer, that they know how to handle the food properly. So this is just a little graph or depiction of how bacteria can transfer. And what you'll notice is there's a lot of arrows pointing both directions, right? So these things can all go back and forth. And so wherever that source is it from the food animal? Is it from the environment? It could be from a human. So a sick worker is probably the worst thing in the world to have in your production facility, or especially on the farm harvesting produce. But again, this is just showing that all this stuff can go back and forth. It's not typically a one-way street. So bacteria in post-harvest processing, one thing, so if you think about, say, bag salads, for example, I know most of us are a fan of those. They're quick and easy, ready to eat. And when you walk into these facilities, they're almost all at refrigeration temperatures because they want to keep all the fruits and vegetables cool to extend the shelf life. So they're maintaining what they call cold chain. And that's great, but the problem is we do have one bacterium, Listeria monocytogenes, it's a human pathogen that can grow quite well at these refrigeration temperatures. They grow well at body temperatures too, but unlike, say, E. coli or Salmonella, they don't grow very well at refrigeration. Listeria does. And Listeria, the reservoir, so that reservoir just means where you naturally find it, is in the soil. Right. So if you grow the plants in the soil, Listeria is probably going to be there. So the likelihood it could be associated with the plants is relatively, it could be high depending. And then now you're taking it and putting it into an environment where it likes to grow. And so that in itself is a challenge that the fresh cut industry deals with all the time and is always concerned about. So the industry does know, like I said, they're aware that these problems are there. And so one thing, when I already kind of alluded to that, I teach good ag practices. And really they're just things that you do on the farm to minimize contamination. And so we'll talk about things like water and manure use, worker training programs, how you deal with wildlife, how you handle post-harvest processing and sanitation of any of these food contact surfaces. And so we teach this directly to the growers. So that's one thing, and as well as industry. So the food industry really focuses on good manufacturing practices. And this is very similar to good ag practices, but they're focusing more in a production facility. So compared to a production field, the food industry has a lot more control over what goes on in the facility compared to a farm. Because a food processing facility is typically indoors, it's in a building, whereas a cantaloupe packing house could be completely open to the environment. And so they're just very different. But again, the industry puts a ton of effort on these good manufacturing practices to make sure that they're reducing any risks that could be possible. So I just wanted to touch on regulation because I'm going to talk a little bit more about that as far as what is our opportunities for big data in fresh produce food safety. And so how produce is regulated. So FDA is the federal regulatory agency for produce. And then within that, just in 2016 passed the Food Safety Modernization Act, and in that is what they call the Produce Safety Rule. And so this was the first time that we had regulation that growers must comply to depending on sales, and I'll get into that, sales and who they're selling to sell produce in the US. And so the produce industry never had any regulation before. And then in Indiana, it goes down. So the regulatory agency in Indiana is the Department of Health. And then sometimes the county health departments could get involved. And sometimes there's growers associations that put even more stringent standards on what, even beyond what the government or the state would want these produce growers to do. And again, just from a liability / food safety perspective. So with this FSMA produce safety rule, this, like I said, is a federal law, and growers now have to comply to this. And so this has been a huge deal. And we're in our 3rd year of implementation here in Indiana with the Department of Health being the regulatory agency. And so far, everything's going really well. But you can imagine how it scared growers half to death by having this the first time that they ever had to be regulated. And then within that, so that's a federal rule, but within that, buyers can also request a third-party audit. And this is all buyer driven. And so a buyer will want to say they want to buy from a certain farm. They're going to require that farm to get a third-party audit from somebody like USDA or Primus. So this is the independent third-party auditing firm that's going to go out to the farm and make sure they're following all the good ag practices. So they check all these different things, and at the end of the day, if they pass, they get a certificate, and then the buyer says, okay, I'll buy from you because you've passed this third-party audit saying that you follow all these good ag practices. So we'll get in. I just want to introduce this stuff because this is where I'm going with some of this big data. So you can imagine the data that's actually generated from going in at these farms and doing these audits. And then lastly is the GAPS training, and that's like what we provide. So if you are covered by FSMA and you need a third-party audit, you have to have this training. And so that's kind of where we fall in to this whole regulatory side and third-party audits. So what does this third-party audit tell us, and the inspections for produce safety rule compliance? So we're going to get a ton of great information regarding food safety, right? So all these bullet points I have here, they're going to gather that data. They're going to know what their cleaning and sanitation program is like based on that audit report and based on the inspection report. They'll know the water testing, they'll know traceability, environmental monitoring. So they're going to have all this data based on what that third-party audit is and what comes out of these inspections for the produce safety rule. So we can get a ton of information. So what if we take this information from these audits and put it in a searchable database by farm? And so for say example, there's an outbreak and you can trace it back to a particular farm. Well, then we could look at these audit reports and the inspection reports and see where there were possible food safety fails in the operation. And then what the goal would be then to have some sort of correlation between what was responsible for these outbreaks and the fails in the audit report, that we could then identify key areas that lead to an outbreak on the produce farms. So that's all great, right? And I keep thinking this is something there's so much data right there that we're just not looking at. But a lot of it is because this would all have to be in some sort of digital format, and not all. We're getting there. It's moving that way, but there's still a lot of paper floating around in the produce world. So that would be definitely a challenge of getting everything in a digital format. And also currently there's limited to no communication between the regulatory side and third-party audit firms. So if the Department of Health comes in to do an inspection, they're not going to be looking at those audit reports from the third-party audit firm. So those things are almost like two independent things. However, somebody could come in the middle and put them both together. And of course, growers are hesitant to have their information available or have it publicly available. So, this would have to be done very carefully and thought through very well before I think this could be a possibility. But it's just, there's a ton of information just sitting there that we could use to help improve food safety and produce.
So Dr. Deering, if it's okay, I'll interrupt because we have a question in the chat that I think it's relevant to what you're talking about right now. And so the question is, how much does this PSR audit cost? What's the price of something like this?
So if it's the PSR, if it's the federal one, there's no cost. But if you're doing this third-party audit, it just depends on the size of a farm. So if you're a smaller farm, it's like 1,500 to 2,000. Larger farms can spend up to tens of thousands on audits every year. So it just depends on the size of the farm.
Okay, thank you.
Good question. So again, I think I've already went through this. What do we gain? We can go beyond good ag practices and get more information to help assist with these recalls and what's causing the problems. So now I'll turn it over to Jennifer Crandall. And now I don't know if you're doing an introduction, Bruce, but she's going to go into more detail on what we were just talking about.
Yeah, this is great. I might have another question for you, though. I thought it'd be good to intersperse the questions here before we turn it over to Jennifer, and then we'll take more at the end. But so thank you for answering the one question. But what about sensors? You talked mainly that the data source would be audits, and that's like observations and records and those kind of things. But what about like sensors along the way? Where are we with that? Are there bacteria sensors? I'm revealing my naivety here. Color and texture and all that kind of stuff. What can sensors help us do to determine food quality?
Yeah, so there's not really, to my knowledge, a good sensor that's is being used by the industry. But what they do use, so they try to maintain. So, for example, maintaining cold chain is important. So we know if we keep that produce cold, the likelihood of a lot of these pathogens growing in the produce will stay pretty low. So they do have sensors that will monitor that temperature. So all through, through production, through transport, at the store, at retail, things like that.
Yeah, that's a good point, because I understand like the trucks that bring the fresh vegetables, the lettuce and all that kind of stuff, if they're crossing during the summer, crossing across Nevada and Arizona from the California Valley over to Indiana here, I mean, they can warm up a little bit, I've understood. So
right. Yeah, exactly. So looking at those kind of things right now that's important to just, we can control the how the stuff is stored.
So let's go ahead and I can save my additional questions to the end, and there'll be more in the chat, I'm sure. But thank you very much, Dr. Deering. That provides the good foundation for our further discussion. And so now I gave a brief introduction at the beginning, but the owner and founder of Safe Food and Root, Jennifer Crandall. And I don't know if you need to turn things over, but I was impressed. You have in your pedigree is Smith Dairy, Kroger, and Safeway. Those are some pretty big players. And so take it away. We'll be anxious to hear what you have to say.
All right. Well, I switched over to my screen now. So thank you. I do appreciate it. I do want to do one minor correction, because when you introduced me in the beginning, you mentioned a doctor. I'm not a doctor, so I want to make sure that's off the table.
Oh dear, I'm sorry about that.
Oh no,
yeah.
it's fine. I just wanted to make sure that everybody was aware that. So my background, I have a Purdue food science degree, and I apologize. I keep looking at my color choice of shirts, and it's not very aligned on my profile pic either. So I'm going to be working on that, so I'm a little bit more Purdue friendly in the future. But and unfortunately, my logo is not the right colors either, right? So that's all right. I do have 8 years of manufacturing background, not in the produce sector itself. I worked in dairy, as you mentioned, Smith Dairy. I worked at Crossroad Farms Dairy in Indianapolis. And then I switched over to Safeway and worked in their Seattle facility, Bellevue milk plant. And then I also worked in their Capitol Heights, Maryland ice cream plant, which that is no longer open anymore. And then I did a couple of, it's like 2 years in a company called H.R. Nicholson in Baltimore, Maryland, which did a lot of aseptic juices. And, Dr. Deering mentioned how the rollout of the produce safety rule has been a little bit, difficult for some of the produce industry to just get used to and get accustomed to. When I was at H.R. Nicholson, the juice HACCP rule was rolling out with the FDA. So I have familiarity with how it feels to have that in the background going on. And it's hard, it's tough to navigate. So, and then I did spend 12 years at corporate Kroger after I worked at Smith Dairy for a couple of years as well, Smith Dairy in Richmond, Indiana. So then corporate Kroger experiences what was foundational to giving me a lot of courage to find my own business. I do like to say we make corporate level food safety programs accessible to small and medium-sized businesses. We work with all different types of facilities, from USDA regulated to FDA regulated. We spend most of our time in the FDA regulated facilities. So, and then I also just, I recently contributed to Dr. Darren Detweiler's book, Building the Future of Food Safety Technology, Blockchain and Beyond. While I was at Kroger, a lot of the work that I did the last couple of years before I founded Safe Food en Route was help with setting up their supplier hub, and did a little bit of the technology data management. And a lot of the roles that I had at Kroger was managing the third-party certifications that Dr. Deering was talking about in her portion of the presentation. I was managing those for Kroger. And so I had a good understanding of how to do that. They have upwards to 10,000 manufacturing facilities and or growers that they're monitoring. So I get the big data conversation very well. I understand how to manage large volumes. So that was one of the reasons Dr. Detweiler and I collaborated, and I helped him with one of the chapters in that book. So enough about me. I don't want to spend the whole presentation on that. So I will move forward if I can. There we go. Hopefully I didn't double click. So just, going back to what Dr. Deering said, and I want to summarize it a little bit in a different way. So she mentioned a lot about the data. Food safety does not start with data. So, she had some foundational things that are, with the pathogenic bacteria and some of the hazards that are associated with produce. We know it doesn't start with writing it down, right? So we have, it comes in all different forms, but it's the entire pie. It's the pie consists of food, of hazards, producers, people, facilities, programs, culture, and then data. Data is just how we kind of connect all those dots. Data created from food safety programs does not have, there was a conference last year, I put this in here about, it does not have a cause-effect relationship with food safety. When we first started talking about big data, and in the food industry, a lot of people were being very critical about being careful how we said that, because the large companies came in and started saying, this is the solve-all for handling food safety. We're going to put it in big data, and big data is going to manage it. And it's like, well, hold on. There's a lot more to managing it than just the data that is associated with it. And so it's like, you have to make sure that we keep that disconnect. The programs are there for a reason. They're to help us keep our processes safe, to keep our people from contaminating and cross-contaminating foods, the facilities clean in a sanitary way. And big data is just there to capture the information. And then we use that big data to help us be able to do more. So with going into kind of like, how can we manage this in another way? The FDA has given us some guidance. They're working on it very much with the industry. They have a blueprint for the new era for food safety. This is their logo that they're using off their website. But they have core elements. It's tech-enabled traceability, smarter tools and approach for prevention and outbreak response, new business models, and retail modernization, and then food safety culture. So they're working on ways to guide the industry so that we can adjust and have certain programs in place. They're really, as Dr. Deering mentioned, like, where are the opportunities that we can digitalize that data? That's what their focus is. So take it off paper. We're killing trees anyway, right? So let's take it off paper. Let's put it in some kind of digital format so that we can use the information to trend it, to do predictive analytics and certain things that would help us. The key, in my opinion, is to make sure, just like my company is that's what we're about. Like, I'm here for the small, medium-sized businesses. I worked at the large retailer. I understand how much they push on the industry, but I also understand that it's not really easy to be able, from a small and medium-sized company, it's not easy to be able to navigate all this. And so I think, in my opinion, it's to make sure that these digital solves and programming that's all getting out there, these software platforms, that they all make it accessible to those small and medium-sized businesses. They have to be part of that conversation. We don't always know the technology, who needs the technology, where they need it. And those companies are usually too early in their stages to invest in it. So we have to make sure that we're including it and being inclusive to those smaller companies. So again, I'll just reiterate, kind of back to my point of data. If you are in the regulatory industry, then you already know, or if you're a food safety specialist in your facility, data not written means the action did not happen. So that's our way of capturing the data. There's other ways to do it. And Bruce, you were mentioning, maybe it's the sensor technology or gathering. So like, we're automatically capturing some of that data. That's a great way to pull it in. And, that's what we need to be looking at. It's critical in my, just in my experience, that you already know that the documentation is there. We just need to pull it in. If the preventive action and managing the hazard was not documented or is not captured somewhere, then regulatory is basically like, nope, didn't happen. So there's no way to prove it if it's not written down. And that's why big data is important. So while collecting data and sharing it forward on things that are critical to the end user and the consumer are good, there needs to be an effort to develop easier methods for collecting it and affordable, as I mentioned. So just to kind of reiterate that part, a growing company doesn't always have these programs in place. Having a camera in their facility might not be the best method unless there is some way to maximize a coaching and training program for them to help them improve. And in kind of the digitalizing the data, the spirit of that, it's helpful to find ways to automate documentation. Making big data available is not the only way to manage it. So create the tools that will help the companies generate reports, trend them, and take action from the information. Let me just push this through. So I know Dr. Deering mentioned a few of the things that could be reasons that we have data collection. Just to kind of capture a few more. And this is a lot from the manufacturing industry that I have, but there's in the produce industry as well. We have a lot of different ways that we collect data and reasons that we need to. So she mentioned, for record keeping purposes, and these are different types of records. I'm not going to read them all to you, but I just want to go back and reiterate her point about regulatory inspections. As I mentioned, if you don't capture the data written, if it's not written down, it didn't happen. The action didn't happen. Third-party auditors and some of those GFSI certifications, Primus, GFS, GAP, global GAP audits, those types of things. That's also sometimes reasons that you need to collect data. And then there's also, there's retailer, wholesaler requirements. So your customers require them, not the consumer. The consumer expects the customer to have these in place. So there are retailer and wholesaler requirements. And then you have customer audits, second party audits, where they might come through your facility and do more. And then I just put in the current GMP logo, good manufacturing practices. Those are also things that get documented and captured to prove that you are supporting your food safety programs appropriately. So questions that we need to be asking in small companies where people are wearing many hats, who is going to manage those 100+ documents that are being captured? Dr. Deering mentioned how much data is. I mean, we're talking food safety manuals that are 3-inch binders of paper. That's what we did 10 years ago. The larger companies are moving that into digital format, but they're not necessarily doing that in the smaller companies. How does the big data help them? How does software help them? These are important questions to ask as tools are created for connecting the data from farm to fork. And keep in mind that if the data is not centralized with their current processes, it's going to be very difficult for them to manage. Integration matters. So configurations, customizing, so talking to techies and people who are developing some of that software, that's a really big key. Connection to the big data matters. So as we watch things like blockchain unfold, and we may not even discuss and say blockchain in the future, it might be something totally different. But as platforms unfold that have that data accessible, trying to integrate with that matters. Trending matters, to be able to trend data and be able to do predictive and analytics. And then permissions. That's, I think, the biggest and scariest thing about sharing big data is, and I think a lot of people are nervous about that. Who has access to my data? What data am I sharing? How do I share it? It just is nerve-wracking to think about how to do that. So those are things that all need to be considered.
So, and Jennifer, if I can interrupt
Yes, sir.
again, I interrupted Amanda, so
You're fine.
I'll just make it even here. But is there, like, food safety would be a little, quite a bit more sensitive topic than like, growing a crop of corn and what you do with corn, or that kind of thing, or a production process in a manufacturing plant, because there's quite a bit of culpability involved, I would think. It's sort of like with medical records, boy, if you note that this thing happened at this time, maybe it's better just to not note that. Is there I guess my question is there some hesitancy for there to be data collected on food quality and safety?
Yeah, definitely.
Yeah.
Oh, definitely. There's a lot of hesitancy in this industry for it. I mean, they're already nervous to share it with the third-party auditors. The third-party auditors have been in and out of the facilities for 30 years. They're more so, I would say, in the past, since like probably the mid 2000s, they've been coming in like 2005, 2006. So we're a little bit more used to sharing data, but there is a lot of hesitancy in sharing too much. And you actually want to have policies written about how much you can share. One of the things that has happened, though, with the Food Safety Modernization Act, that it just needs to be noted that the FDA has a lot more authority than they did before, and they're allowed to ask for these proactive programs, where before FSMA went into effect, they didn't have as much authority to be able to ask for this. So from a regulatory standpoint, the regulators are allowed to ask for it. They're allowed to look at your programs, not just your results of the data, but actually dive into your programs and read them a little bit more thoroughly. And then they also have rights to be able to do recalls. Again, that causes hesitancy, because what if regulators look at my program and say I need to have a recall because they find something?
Right.
So there's a lot of things that cause that hesitancy. And actually the pandemic has really caused the third-party audit community to try to resolve some, like, maybe we need to take videos through, and they've had a lot of conversations about that, because another thing that everybody's hesitant about is pictures. The policy is you don't take pictures in my facility. Most companies will say that, don't take pictures of my facility, and it's either proprietary reasons, or they're nervous that you'll see something in the background. Why do I have a screen up? Because, on my Zoom, because I don't want you to see my office. Also, I want you to see my logo. But, that's the same thing. The same concept is that nervousness of sharing too much and then that being held against you.
Okay, well, very good, very, very good
Yeah.
points. There's a question just came in the chat, and it's from Thomas. And I think this is public. And so I remember Thomas, his days at Purdue here. And the question is there a jurisdiction that is doing this well? I mean, the data collection, storage, monitoring, evaluation, all across the food chain. Who's doing this now?
There's a lot of players that are in this space. So it really depends on what your needs are and what you're looking for. So there's a lot of innovative small companies that are coming out with great ideas. There's some, and if you look up just like data management and that type of thing, you're probably going to run across several companies. I personally, Safe Food and Root partners up with a company called Repositrack, and we use their program and process to help us with our data management. They are masters at data collection, at document management, and that was one of the reasons that we partnered with them. We build our programs around what they do, so it's a very agnostic approach. Not every technology company buys into the blockchain concept right now because it's very early stages for blockchain. Connecting to those, so IBM Food Trust is trying to solve it. If you're a small company, that's a large undertaking. IBM's a big company. They have a lot of big players helping with doing some data management and some traceability tests. So one of the exciting things about blockchain and why the food industry is like, it's going to solve everything. IBM Food Trust did early tests with it and was able to take a recall exercise on mangoes. And, you know, like if you've been involved in a traceability and mock recall exercise, you know, we have goals to get that data collected from, you know, like one step back, one step forward. That's always been kind of the concept of like, I want to know how much volume of product we produced. I want to know where it went, who has it, and where did it come from. So it's just kind of those key elements. And when it's hard to find all that, whenever you have it on paper, that can take, sometimes in a recall event, it can take 7 to 10 days for it to fully unfold whenever you have paper. They were able to do it with one item in 2.2 seconds. The key with that is, and I know we're kind of going off script, so I apologize. But
that's okay. It's often better. It's often the best times when you go off script. Yeah.
I'm very passionate about it, so I could easily go off script. But the problem with that idea, and I don't want to say problem, but it's an opportunity to the tech companies. The food industry is not one-to-one. So it's many-to-many in the relationship. So you have many ingredient suppliers producing one product and then many products going to different places. So you've already got that many to many concept, but you also have, you have to have every single player in the food chain inputting that data. So if you have a break in there that one company doesn't input the data that they're supposed to input, then you have a break in the chain, and then it's invalid. It's not going to work. So it's definitely an opportunity for the tech companies to solve. I've not seen what they've been doing recently because I've been so focused on growing Safe Food and Root, and I'm had to solve my own problems with data management. So I'm trusting my tech partners to be able to keep tabs on this. So we have a lot of good conversations where, you know, around the traceability rule, which is coming out as well. And I didn't even put that in this presentation, but that's another one that we'll have to look at for data management and tracking. So I don't know if that answered your question, Thomas. That was a couple of examples. There's lots of companies out there that are solving it. It's just a matter of who has the best reputation and meets the needs that you have.
Yeah, he can follow up. I'll let you get back on track now, but thank you. Thank you. Like I said,
You're welcome.
It's often the best discussion when
I know.
when you're off the rails a little. So
yeah.
Thank you.
You're welcome. You're very welcome. So, and that kind of ties into exactly this question. So, you know, I didn't pay Thomas for his plug here, but he basically put me right into this slide. So how to manage big data and consider the volume of data that you are managing, the data that you need to report. There's interactive tools that help identify hazards and citations and that sort of thing. So keeping you up to date on, you know, even the FDA has an FDA dashboard that they help you stay up to date with supply types of products and suppliers. Then there's, you know, help with identifying risks and building food safety plans and hazard plans. There's a lot of programs out there that do that now as well. Help writing the programs and policies. There's some that are even giving you templates, which is kind of cool. And then accessibility to technology. So again, going back to, you know, there are a lot of existing programs that require 100+ documents. Who is going to manage it? How are they going to trend it? what other data is needed for managing along the way? Can you integrate? I mean, I'm just giving you a bunch of questions to ask yourself as you go through this. And then what about accounting systems? That's one that people don't think about, is accounting systems, because you're doing your inventory control sometimes through those accounting systems. Some people use SAP and some of those other platforms to be able to help them manage their inventory and their purchasing and buying decisions. Well, those are great points of contact of data. So it could have, you could have a vendor ID number in there or a product ID number in there, and that would integrate in with your food safety software so that you can easily have some conversations between the two and get that free, that traceability data quickly. So those are things to think about. And how can this help with food safety and working around it? So just a little bit more. And then another thing that is not food safety related, but everybody in a call that's about branding and food knows there's a lot of documents that go around other programs. Organic, kosher, halal, non-GMO, and those are just a few. I get requests all the time for gluten-free, and you have to have programs that support that with data. So you have to have, that's a place to look at. Can I add that into the way I'm managing my food safety? Maybe I can do specifications. Maybe I can do document request. So, we design programs with our clients to help them manage it based on what their needs are. But being at Kroger for 12 years and managing it myself, I know the volume of documents that we ask. I mean, you can be asking for 25 to 50 documents from one supplier. And if you're only doing one supplier and you have 10,000 suppliers that you're managing, that's a lot of documents to try to manage. So what I look for in programs is things that help me automate the requests, things that help me automatically get the information so I don't have to be the one chasing it. From an administrative point of view, it's very difficult to do that. And it's difficult because it usually is on one person's desk. And they can't possibly, even in a small company, you can't possibly do that by yourself. If you're managing 50 suppliers, that's a lot. It's a lot to keep up with, and it's a never-ending story. And then, I didn't mean to do that. Apologies. Connect the dots. So what we need, what everybody needs probably, if you're on this call and you're in the produce sector or you're in manufacturing, it's a centralized way to manage the data, not just to collect the data. There are a lot of companies that are figuring this out. Again, I mean, I promise, Thomas, it wasn't there as a plug, but definitely line me up for the end of my presentation. So, but it's most helpful to connect the dots. How can we connect the dots to the needs of the industry and not just to the needs of the regulatory community? And not just the software company ideas. Like, we need to still be having a lot of collaboration around this. And I also should say, not just the big companies. The big companies are who are doing all the tests. We need to get it into the small and medium-sized companies as well and get them interacting as well. So without further ado, I'll put it to questions. If there's any more, I'm sure Dr. Deering will come back on and answer anything else that might be on your mind.
Well, thanks a lot, Jennifer, for that presentation and all your thoughts and years of experience that you're sharing with us. And I don't see any questions in the queue, but if someone would like to ask a question and unmute, if they want to do it verbally, they're welcome to do that, and just interrupt me at any time, because I'll just keep talking if you don't. Okay, so please interrupt me. And Dr. Deering, Amanda is there too to answer questions. But if no one has a question, I've got a couple here. I always have a couple questions up my sleeve. Okay, so anyway, anyone want to ask a question? I'll just pause for a moment here, and then we'll get into mine. I think everyone, I think anyone can unmute.
Oh.
Okay, so let me ask a couple of my crazy questions then. So something that I've asked a couple people, and I never seem to quite get a good answer, and maybe one of you two can give me a good answer, but back, a couple years ago, we had the Romaine Lettuce situation where there was one farm or a couple farms where there were problems with the lettuce, but all the romaine lettuce, I mean, the grocery stores, the warning went out, do not eat any romaine lettuce. And that to me, like, was a shot across the bow. It's just like, are we doing like no traceability with that? Why were all the romaine lettuce farms put at a disadvantage when it might have been just a handful of farms?
Amanda's the produce expert, so I'll let her chime. I probably have some additional stuff once she's done.
And this is a data science thing too, because we should have that traceability in place.
Yeah, so I remember when this happened, I was driving to Minnesota to have Thanksgiving at my in-laws, and the phone started ringing. It was Indiana growers. There were some, we don't have a lot of lettuce growers, but we have some, mostly indoor, and saying, nobody will take my lettuce. And of course that outbreak had nothing to do with Indiana growers, but the problem was at that time, they weren't identifying the actual location of where that lettuce was grown. So they knew it was romaine. They didn't know where it was grown. And we didn't have a way at that time to identify what that bag of lettuce that you were buying. Was it from Yuma? Was it from California? Was it from Florida? And so that's why the decision was to just say no romaine lettuce. So that impacted everyone. So even these indoor farms that certainly had nothing to do with that outbreak had to recall everything. And however, now they do on the packages, they do say where that lettuce was produced. So now we don't have that. At least, if it was something that they know happened in Yuma, then they would know that then that lettuce from Yuma would have to be recalled, but not the stuff that was grown in California, Florida, or wherever.
Okay,
else.
so we are making some progress in that area.
Yeah.
So because you probably recall the Portlandia episode where the Colin the chicken was served, and we knew that Colin was a nice chicken, and that all this kind of, it's a funny spoof on Portlandia. And I never watched the series, but I happened to see this on YouTube. It was hilarious, but good. So we're working that way. So another oh, good. Here's a question in the queue. And then I've got a couple of questions more. From Michael, is there an organization such as AIAG, the Automotive, NADCAP, Aerospace, or Metacred for farmers and producers concerning food safety processes and standards?
Yes, there's a lot.
Okay.
Yeah, so like the Global Food Safety Initiative has several schemes now that are in there. So like audit standards, globally recognized ones, and Dr. Deering's very familiar with all those, so she probably can share a little bit more detail on it. But Primus GFS, Global Gap, there's for outside of the country, Canada Gap. I think there's a couple of, there's now an Asia Gap. So they're starting to get globally recognized standards. The Primus GFS and Global Gap and Canada Gap have been used for probably 15 years now or more. So the Global Food Safety Initiative is a group of an industrial representation, academic, and I doubt there's much regulatory, but there is customers involved with setting the standards for them. So it gives them a very strict guideline of it. And then there's auditing companies that audit against those. Primus is one of the auditing companies as well, Primus Labs, but there's several other auditing firms that audit against those standards. So they come on the farms, they look through the programs and the food safety programs that they have in place and measure them against these standards and then give a report out. They don't earn the certificate unless they pass all of the requirements. So it's a nice checks and balances way of managing it. Most, if not all of the retailers and wholesalers and food service distributors require that companies use those. So it's kind of a top-down push from the industry. The regulatory groups now have the produce safety rule for the US side. So we also have that going on from a regulation point of view.
So it seems like one of the issues in terms of data in food science is that there's multiple players and multiple hands that touch it, and it's often hard to make all those links between all those various producers and processors and wholesalers and distributors and retailers and all that kind of stuff. I mean, that's common in other industries. So Here's a off the wall question, and then I see we have one more in the queue, but let me ask mine. This isn't really data related, but is our aseptic type lifestyle, or that we try to have an aseptic lifestyle, does that contribute to our food safety issues? I mean, if I would just eat a little mold off the cheese occasionally, or, when the milk starts to get a little blinky, if I would just drink a little of that, could I sort of vaccinate myself, do a little self-vaccination to keep me more resistant to food-borne pathogens?
I'm going to let Dr. Deering answer that. I'm not a doctor.
Question.
Let her answer that.
Well, yeah, and there have been studies that they show that, people in cities are more, susceptible to some of these foodborne diseases than people who are in the country. And yeah, there's certainly something to that. The problem being, though, what's happened is it's all a big liability issue. And so, there's lawsuits. I remember I worked for several years with Dole Fresh Vegetables, and I think at any one time they had 5 to 10 lawsuits out there because somebody got sick from eating something. So I think on that side, the food industry, I mean, even, would it, you could immunize yourself or whatever in some of these things.
Eat dirt.
Yeah, right.
Eat some dirt.
Well, I mean, it's the excuse
Have your kids eat worms and dirt.
Yeah, when my daughter sees that the milk is expired 5 days ago and I'm still drinking it, and the comment I make to my daughter is, I'm protecting myself, but I know you can take that too far too. So, well,
and just to add to that, because I'm sure Dr. Deering's more familiar on the studies, but from my, I think this is probably a couple of years ago that I had heard this, that we have connections to allergens being more of a problem because of that as well. So there's some studies in the medical community that talk about the countries that don't have the same types of sanitation programs that some of the more developed countries do have, that actually helps them be able to fight off the allergens and the bacteria better than we're able to do.
So great discussion, and thank you. Just one more, and then we'll probably need to wrap up. Here's the question. I see some similarities between the decarbonization movement and food traceability. What are your thoughts around the role of finance and insurance in promoting traceability and transparency? For example, do you hear examples of financial institutions or insurance companies desiring these protocols to be put in place?
So, well, I'm seeing movement on recall programs which support traceability side of it, and that there's recall insurance that's out there now where they are giving companies a chance to prove their programs that they have in place, and then they'll give them insurance to help them with coverage just as a backup. And that movement's been going on a few years. So I definitely see the value. The blockchain community is very interested in the financial and insurance companies anyway. So they're seeing all the different applications of where it makes sense to have that type of program in place. So I think it's helpful if the entire industry is adopting it. It's also helpful, or I shouldn't say industry, if all industries adopt that type of program, or I don't know what the right word is.
So the liability insurance for a company might be less if they do certain protocols, just like if I'm a safe
your premiums
driver,
might be better. Yeah, it's like the auto insurance. You have less accidents, you get better premiums.
Right. Mm-hmm. Okay, so I think that's a wrap for today. And boy, I've learned a lot today. And so I really thank both of you for your insights. And this is my first time at this for a while. And so I'll probably need to depend on Randy, our organizer here. But just a couple of words. If Randy, do I need to switch back to the ending slide, or would you switch it for me, please?
Okay, just say thanks everybody for coming, and tune in next week because we do this every Thursday.
Thanks again, everyone.
Thanks for having us.
Yes, thanks everyone.